Zimbabwe has been characterized by recurrent epidemics in relation to cholera and typhoid. There is a big issue in relation to the water availability, particularly safe water to drink for the population. So all this combined is creating a huge increase in waterborne diseases.
The problem in our community is waste management is too high. No taps. Our toilets have no sewages, and through direct outside, many flies. There are many people, like one room carries 4 families and young children.
It's 5,700 people living here inside. It's using that only one bowl, and the other one is dead.
So MSF would come here with a plan and started to drilling boreholes, which are now saving people from getting those diseases from cholera and typhoid. I think this is the only source of clean water here in Mbare right now.
While drilling a borehole, it's extremely important to put in place properly the borehole sanitary seal, which protects the borehole from anthropogenic pollution. In Harare, we have rehabilitated above 60 boreholes in 13 suburbs, and we have drilled above 10 boreholes. I guess our 12th borehole we are drilling in Harare with this innovative technique, which we call it a super seal as well. In the toolkit, we already have 4 components which we have tested and implemented in Harare and in the region, which is borehole drilling, geophysical surveys, borehole diagnostics, and community health clubs.
A community health club, to sum it up, is a group of people between 15 and 50 that come together and are taught on participatory health and hygiene education and become the custodians of a water point. From 2015 to date, 2019, we've got plus or minus 70 community health clubs. Most of them are concentrated in the epicenters of diarrheal diseases in Harare, which is Budiriro, Glenview, Kuadzana, and Mbare.
This point helps because of cholera and typhoid. People get help from this point. I fetch 2 buckets per day. I use water for cooking and drinking.
Every day when they come to fetch water, sometimes when the people can come would say, my husband or my children, they've got running stomach. We taught them to make salt and sugar solution. So we are working as a nurse.
This program is helping a lot in prevention. No? With the community health clubs, we are able to do health promotion messages. We are able to notify when there is diarrhea cases increase, so we are able to follow the trends. And that helps us as well to see where are the main needs in relation to water.
Using the experience which we had in Zimbabwe, we used this positive feedback into Malawi and Mozambique to ensure that these guys also adopt the very same concept which we got from Zimbabwe.
In the upcoming pilot projects, we are concentrating on waste management, cost-effective sustainable sanitation, and community empowerment on waste management, coming up with the toolkit.